My name is Sherrie Rodriguez, and I had my iFuse done in September 2023. SI joint pain affected my personal life by not being able to go out to events. I couldn't even go to the grocery store to buy my own groceries. Physical therapy, I went, and within 2 weeks of going, the stretching started aggravating the pain, and the physical therapist said, you know what, this is not working. I need you to go back to Dr. Lay and see what's going on.
My name is Dr. Tien Lay, and I'm a board certified and fellowship trained neurosurgeon. My practice is the Total Spine and Brain Institute here in the Tampa Bay area, and we're here to discuss SI joint pain. The SI joint, or the sacroiliac joint, is composed of, on one side, the sacrum, which is the tailbone, and on the other side, the iliac bone, which is the pelvic bone. It's stabilized by ligaments and muscles. In most instances, it moves very little. The primary role for the sacroiliac joint is to transfer weight and to distribute it evenly throughout the body. SI joint pain, or sacroiliac joint pain, is caused by degeneration. When I see patients with sacroiliitis, they usually complain of low back pain. They will be able to tell me where the pain is and point to it in the lower back area or in the buttock region. They will often shift in their chairs and try to avoid putting pressure on the affected side as much as possible. SI joint pain is very common. It can affect 15 to 30% of people who complain of low back pain. So it is important to distinguish between SI joint pain versus pain that originates from the lumbar spine. Up to 43% of patients with symptomatic low back pain following lumbar fusions indeed have sacroiliac dysfunction. When I look to make a diagnosis of sacroiliac dysfunction, I look for a complete evaluation, including the physical exam, in addition to the history of the patient. These include positive provocative tests, and when there's a high suspicion for this condition, I then schedule for a diagnostic injection to confirm that this is indeed the sacroiliac joint that is the pain generator for the patient. When the patient has sacroiliac dysfunction, there are a variety of treatments offered to the patient, most being non-surgical. These include non-steroidal or anti-inflammatory medications. These include physical therapy. It may also include radiofrequency ablation. It may also include bracing. Only after an exhaustive use of all non-surgical means is a minimally invasive surgical option offered.
At first, I found out that I had SI joint dysfunction after the injections from Dr. Lay. After having the injections, I felt instant relief after getting up from the table. I went online and did research on the iFuse surgery and went to Dr. Lay.
The iFuse torque procedure is performed through a small 2 to 3 centimeter incision on the side of the buttock, and 3 implants are placed that connect the hip bone to the tailbone to immobilize it or to fuse it. This procedure usually takes me approximately 1 hour to perform. To me, iFuse is the best option to provide sacroiliac fusion, primarily because the technology that is used with the torque implants is state-of-the-art.
My recovery was smooth. I was in bed about a week and with the walker for a week, and then after that, I started walking. I would tell people who are considering this procedure that it is a great thing to do because of the outcome. No more pain. You can get back to life, doing things in your life that you wasn't doing before. I am now back to doing my usual activities. Walking was one of the first things that I missed a lot.
As a neurosurgeon and a spine surgeon, I come across a lot of people with low back pain and who are often treated with lumbar procedures, including fusions. In a perfect world, this would take care of all of the pain issues for the patient. However, a very significant portion of patients still continue to have low back pain despite undergoing an excellent lumbar procedure. This made me wonder if there were other pain generators to consider, and in fact, the sacroiliac joint is a very important part of the anatomy to consider when it comes to low back pain and where it could originate from. If you suspect that you may have sacroiliitis or sacroiliac dysfunction as a result of some of the topics that we discussed today, I invite you to contact our office at Total Spine and Brain Institute to come in for an evaluation